I'm Linda Tyler. I work at the University of Utah. I'm in the College of Pharmacy. I'm a clinical professor there. I teach drug information and literature evaluation in our curriculum. I went to school at the University of Utah, got my bachelor's degree, did my residency at University of Nebraska Medical Center, came back to grad school to get my Doctor of Pharmacy degree at the University of Utah. This was at a time when the Doctor of Pharmacy degree was optional, but now to be a pharmacist, everybody gets a Doctor of Pharmacy degree. So nobody would get it in that sequence now. My very first job out of graduate school was at the University of Wisconsin. I was a critical care pharmacist there. I was there for several years, and then I moved to Columbus, Ohio, and I worked at Columbus Children's Hospital. It's now Nationwide Children's Hospital. And there I was a poison control center specialist. We were there for a couple of years, and then we moved back to Utah, and I was the director of the Drug Information Center. At the time, as director of Drug Information Center, it was just me and lots of students that worked on the service because we were a training area. And then after several years, we got more and more staff. And then over 22 years, I worked in the Drug Information Center. So we would respond to questions from healthcare providers within our organization. We would develop policies to guide the medication use within the organization. And as we got more staff, we were able to do more of the quality improvement activities within the organization. So a really fun job. But after 22 years and after teaching the required drug information and literature evaluation courses in the curriculum, I moved to another position as the chief pharmacy officer for the system. So I'd never really thought of going into leadership, but it was a great opportunity and I really enjoyed that job as well. So I did that for 13 years and then I decided that I really wanted to make a change and move back over to the college, again teaching literature evaluation again, and it's great to be working with students again. And so that's where I am now, and it's kind of fun being a full-time faculty member. So my career is a little bit different, and I've worked in specialized practices all throughout my career, but I've worked in several different ones, and each one required that I retool for the new position. But that's part of what made being a pharmacist really exciting and being able to do different things during my career. So when I was thinking about pharmacy, there were not a lot of women in pharmacy, and that's really changed now because now the career is over 50% are women. So it's pretty exciting to see the changes that have happened during the time that I've been a pharmacist. But at that time, there weren't very many women, and I liked the sciences, but I couldn't envision being in a laboratory. And those were the kinds of careers that people said, well, if you like the sciences, you might like doing research. And the answer is no, I really don't think I would like doing research. During high school, I volunteered at the hospital. I was a candy striper. I don't know if they even have candy stripers much anymore, but I was a candy striper. And so I got to see sort of all the different careers there were in a hospital. But I really liked working in a hospital. I really liked that, everything you did, even as a volunteer, you knew you made a difference to the patients that you were serving. And I liked that. So when I was researching careers in healthcare, I realized that as a pharmacist, you need a little bit of physics, a little bit of biology, and a whole lot of chemistry. And that really appealed to me that I could use my science brain, but do something that really mattered to me in terms of taking care of patients. So I'm going to give you a couple scenarios of what a typical day would look like. So I think first I would say in pharmacy, I don't know that I've ever had a typical day. There's things I do, but every day is different, and every day you have new problems to solve, and that's part of what I really liked about pharmacy throughout my career. So as a faculty member, that's actually probably the most predictable of all, in that I have set times when I'm teaching classes, I have times when I'm working with students, I have to set aside time to prepare for classes, both preparing for lectures and preparing for exams, and things like that. Then I typically have a committee load, so there's several committees that I am chair of, so I'm organizing the work of the committees that I work on. So one committee is about continuing education. So that committee, we think about the different things that we do for what are the needs that pharmacists have for their continuing education, and then we plan programs to help meet those needs. Another committee is involved in reviewing faculty members. If you're on a faculty, you're going to have routine, it's every 5 years, but routinely, you're going to have routine reviews, and there'll be a committee that will review your file, and then they'll make a recommendation whether or not you should be retained on faculty and whether or not you should be promoted. So for the last couple of years, I've been chair of that committee. And so I'm responsible to help faculty members get their files together so that they shine in all the areas that we want them to and that they really portray everything that they've been doing. Then a team of us, review the files and make a recommendation to the department chair. Having worked as a pharmacy leader in the hospital system, I actually find working on the faculty side and reviewing faculty files really rewarding. It's really an opportunity to help everybody continue to improve in their position and really recognize the great things that faculty members do. So those are just 2 examples of the committees that I've been assigned to over the last couple of years and some of the things that we do. One of the things that as a faculty member, you're going to be working collaboratively with other faculty members, both within your department and with other departments. You'll have the opportunity to work with other committees in the Health Sciences Center, meet people from other colleges, and work on projects together. So I really like being a faculty member. I was always a faculty member throughout my career, but often as what's called a split faculty member. So a part of my time would be dedicated to faculty activities, but most of my time would have been working in the hospital. So what I like really now about my position is that I'm a faculty member and I'm not split between other positions. The advantages of split faculty members, though, is that you have this wonderful clinical practice in the hospital, and then you're able to work with students who want to train and learn more about what you do in the hospital. So, for instance, when I was a critical care pharmacist, I would come in the morning, I'd get up to speed on all our patients, I would check their laboratories, and I'd get ready for rounds, and then would meet as a healthcare team, so the physicians, the nurses, the pharmacists, the respiratory therapists, and would discuss the patients and would talk about what the goals of therapy were, what needed to be done, and if there was any changes. Obviously, as a pharmacist, I was making recommendations for changes in the medication therapy. So I really enjoyed having students on service with me, and we'd get an opportunity to show them how I would work through a patient and how we'd think about all the things that we needed to make sure that patient got the best care while they were in our ICU. Drug information is a little bit different kind of practice. And again, we were in an area where we had lots of people that trained there. And again, no day was the same, but we had a call center. So any healthcare provider within the organization that had a question about medication therapy could call us and we would research it. And every question posed a different set of problems and a different challenge in terms of working with a patient care case. Now, we had clinical pharmacists on the medical units who were also working with the patients. So typically we would get the questions that would be hard for them to answer, or they couldn't find the resources easily on the floor and we needed to spend a little more time looking it up. Oftentimes the questions that we'd get would say, this is a really important issue. We need to create a policy or a guideline so that everybody can follow it and know what to do in these particular situations. But what's really great about a drug information practice is that it's lots of problem solving every day. So every day it's, yes, people are going to call you, but you never knew what problem you were going to get and what problem you could puzzle out. But you knew in each and every request that you answered that you helped somebody take care of patients better. Another part of what you do would be work with other committees in the hospital to help, again, set up guidelines and research that. So again, even though in developing those guidelines to help healthcare professionals in the organization to know what to do in different situations, you were solving problems, you were bringing people together to work together as a team to solve that problem. And that was tremendously satisfying to me to know that we could figure out how to use medications better within the organization and how we could help improve care and improve what we were doing. When I became the chief pharmacy officer for the system, we're a relatively big health system. We had 4 hospitals. We had many community clinics within the system. By the time I left that position, we had 17 pharmacies within the system, each of them doing a little bit different things, many of them working with our clinics and with the providers in our clinics and working with the patients in each of those locations. So my role really changed from actively solving problems to facilitating helping others solve problems. So my job was to make sure our teams in pharmacy had the resources they needed to do their job really, really well. And that's pretty exciting. We had the opportunity to recruit fabulous people to work within our system. And so actually one of my favorite things was actually interviewing people for positions that we might have in the organization to make sure that we got the best people to work in our organization and to make a difference. And I would say to anyone who was interested in pharmacy or who was interested in working on a team is that you had to be able to work together in teams, and you had to be flexible because things would change and our practice would change. We'd continue to figure out new ways to do things better and take care of patients, and as pharmacists to have a more active role. We were really fortunate at the University of Utah that we had really active interdisciplinary teams. So when you came to work there as a pharmacist, you got to work with physicians and nurses, and you got to make decisions together as a team. And you as a pharmacist got the opportunity to make many recommendations around medication therapy to help make sure that patients got the best benefit from their medications, but also too, you were in the perfect position if there was any problems or if patients were having an adverse reaction that you would be able to catch it. And as a team, you could kind of work together to solve that problem. So it was, I had the opportunity to work in many different practices, all of them very exciting, each of them very different. And each of them, I would say, there's just not a typical day. You just had to be flexible and roll with it in terms of whatever needed to kind of be done that day, but also to plan, to be able to do this really collaborative work with the teams you were working with. Well, I think pharmacy is just the best. It's a great, great place to be. I think if you're interested in the sciences, because it takes a lot of science to get through pharmacy school, lots of chemistry, lots of biology, a really good understanding. But you get to learn how drugs work and how they work and for whom those drugs are going to work the very best and how to implement them in patient care. And then in the last year of your curriculum, you actually are on medical units doing what we call rotations, where you have a preceptor that you're working very closely with. You get to learn what that preceptor does and the kinds of patients that they take care of and the kinds of disease states that they work with. And you get to problem solve in working with different patients to see what medications would help them the very best and to work very closely with an interprofessional team. So I liked a lot working together in teams. I liked the solving problems part. I like the communication part. You have to have really strong communication skills as a pharmacist, both in terms of working with providers, physicians, nurses, other healthcare professionals in the organization, as well as working directly with patients. There's different specialties, as I've described in pharmacy, but some are very, very focused on patients and have lots of direct patient interaction. Think community pharmacy, the pharmacist working with the patient, asking about the drugs. They're going to develop a really close relationship with that patient. When I was in drug information, my close relationships were with other care providers and supporting them. So there's a whole range of positions in terms of how much you work with patients, how much you work with providers. All of them require really strong communication skills.